Our last part of Chapter 14 of Special Populations will focus on respiratory conditions and other conditions. First, we will look at respiratory conditions. Respiratory conditions are problematic for individuals who exercise because their lung function is compromised. Consequently, they may not be able to exercise as easily as an athlete without a respiratory condition would due to the decreased oxygen provided to the body. However, with continued exercise, the respiratory condition can be improved, as well as the overall athlete's health. First, we will look at asthma. We have already looked at asthma in previous section, but let's review it again. Asthma is a condition that causes the bronchi to swell and become narrow. Because the passageways are not as large as normal, an inadequate amount of oxygen is transported to the lungs. Asthmatic individuals perform better when exercising in warm, moist environments versus cold environments. For those with asthma, shorter duration exercises with intermittent bouts are better tolerated than long duration strenuous activities. Over time, aerobic activity produces more efficient lung capability to take in and utilize oxygen, decreases exacerbations of asthma or asthmatic attacks, increases general overall fitness and cardiorespiratory endurance, and promotes easier and better activities of daily living. With those that have asthma, we need to work closely with the athlete's doctor. If the athlete is prescribed by their doctor a bronchodilator, they need to make sure they utilize their bronchodilator prior to exercise. We need to make every attempt to have the athlete exercise in an environment free of any triggers or allergens. However, avoiding potential triggers is not always possible. Therefore, we need to make sure that the athlete must have a rescue inhaler medication with them at all times during exercise in case they experience an exacerbation. Next, we will look at COPD. COPD stands for chronic obstructive pulmonary disease. This is a common respiratory condition that involves chronic bronchitis and/or emphysema. COPD most often affects men over the age of 60 who smoke or have smoked consistently in the past. A person with COPD cannot be cured. However, signs and symptoms can be treated and decreased through medication and exercise. Signs and symptoms that we need to be aware of those with COPD include a persistent cough, wheezing, inability to breathe at a normal rate, decreased lung volume, and shortness of breath, especially with exertion. Along with different typical types of exercise, individuals affected with COPD benefit from increased efficiency of the functional lungs and cardiovascular system, decreased wheezing and shortness of breath with everyday activity, and decreased respirations and oxygen necessary to perform activities of daily living. We need to make sure that those that have COPD have immediate access to their medication during all times of activity. We also need to consult with the athlete's physician prior to devising an exercise program to determine the effects of the medications on the athlete's ability to exercise. Athletes with COPD may also have difficulty maintaining lean muscle mass. Some athletes may need supplemental oxygen during exercise. Overall, we know that skeletal muscle function is a key indicator of COPD in advanced stages, and exercise can resist in reversing this dysfunction. Strength training also has been shown to improve health-related quality of life for those that have COPD. During aerobic exercise, we need to use a rated perceived exertion of approximately 11 to 13, which is light to somewhat hard, to determine the appropriate exercise intensity. Those that have COPD always need to be closely supervised to make sure he or she does not experience dyspnea, which is shortness of breath during the exercise session. Lastly, we will look at cystic fibrosis. Cystic fibrosis is a hereditary, life-threatening disease characterized by an abnormal quantity of thick, salty mucus that exists in and clogs the air passageways and other body organs such as the lungs and pancreas. The mucus can cause lung infections and digestion complications. A child is usually diagnosed before the age of 2 years old of cystic fibrosis. Signs and symptoms that we typically see with cystic fibrosis include constipation, nausea, loss of appetite, discolored stools, fatigue, nasal congestion, coughing, recurrent pneumonia, and pancreatitis. Individuals with CF can particularly benefit from exercise by increasing cardiorespiratory efficiency. Aerobic and strength training exercises have been shown to benefit the individual with CF by increasing lean body mass, maximum oxygen consumption, respiratory muscle endurance, and high health-related quality of life. As with other respiratory conditions, athletes with CF utilize prescribed bronchodilators. In addition, individuals may also be taking additional medications for their condition. We need to make sure that when we prescribe or develop a program for those that have cystic fibrosis, we need to be aware that these individuals can tolerate exercise in the heat, even though they lose excessive salt when sweating. Because of this, we need to make sure that we require adequate fluid replacement during exercise. Some athletes with severe CF may have lower extremity joint pain that hinders their capability to perform lower body weight-bearing exercise. Overall, aerobic activity should include large muscle group exercises such as swimming, walking, jogging, and bicycling. Many athletes with CF can tolerate high-intensity prolonged exercises. However, exercise sessions should be under 20 minutes when the athlete begins an exercise program, and session length should increase very slowly. The athlete eventually can perform 30-minute sessions for 3 to 4 days per week. Intensity progresses to 80% maximum heart rate. Strength training activities involve large muscle groups and functional activities focused on activities of daily living. Next, we will look at two other conditions. One of these conditions is anemia. Anemia is a condition in which an individual's blood contains insufficient red blood cells, which results in decreased oxygen to the body. Anemia is caused by lack of iron and vitamins in the diet, especially B12 and folate. Decreased red blood cell production, the body's breakdown of red blood cells, blood loss due to gastrointestinal bleeding or injury, and chronic disease. Typically, signs and symptoms of anemia include fatigue, cold extremities, headaches, dyspnea, and dizziness. There are two different types of anemia that we commonly see. First one is common anemia. Common anemia conditions include iron deficiency and vitamin deficiency anemia. These conditions are easily controlled. Most athletes affected by iron deficiency anemia are women. The other type of anemia is sickle cell anemia. Sickle cell anemia is a hereditary condition that typically occurs with African American men. With this type of anemia, the individual's red blood cells are a sickle or crescent shape instead of a normal circular shape. Consequently, oxygen carrying capacity is diminished. Also, due to the red blood cell's sickle shape, they can become lodged or clogged in a small blood vessel, which blocks blood and oxygen flow to the tissues. Anemic individuals have decreased oxygen to the muscles at rest because iron, which is the oxygen binding site in hemoglobin, is not sufficient in the body. Overall, sickle cell anemic individuals can participate in high-intensity exercise without any issues. However, we need to mostly keep exercise at a moderate intensity or moderate level. Various aerobic activities following the FIT principle and progression are appropriate for the anemic athlete. Athletes who have iron deficiency anemia must supplement their diet with iron-rich foods including red meat, chicken, turkey, fish, spinach, beans, broccoli, and any iron-fortified foods. Iron supplements may be necessary for individuals with severe cases. To treat vitamin deficiency anemia, the athlete's diet must contain foods rich in B12 and folate. Lastly, we will look at pregnancy. I've included pregnancy in this presentation because some of you may be working with the pregnant athlete as a personal trainer or those in a physical therapy setting, or likewise that need to be aware of what we can and cannot do while an individual is pregnant. Although pregnancy is not an illness or a disease, it is a condition that affects a woman's ability to exercise. Pregnant women greatly benefit from exercise. Benefits of exercise during pregnancy include all cardiorespiratory benefits, maintenance of healthy weight, a decrease in back pain during later pregnancy stages, a decreased risk of gestational diabetes, an increase in energy, and an increase in muscular endurance. The women's physician must approve exercise throughout the pregnancy. They also may not clear a pregnant woman for exercise if she has been bleeding or spotting, had previous miscarriages or previous premature birth, a low placenta, or a weak cervix. Overall, exercise should focus on aerobic and flexibility exercises versus strength training exercises. Pregnant women can benefit from these aerobic and flexibility exercises for at least 30 minutes a day, for as many days a week as possible. A woman who was exercising regularly prior to pregnancy can probably continue her pre-pregnancy level of exercise during the first trimester with her physician's approval. Those that have not been exercising regularly prior to pregnancy need to be eased into any exercise that they are doing in that first trimester. The athlete that is pregnant should exercise on a flat surface, wear comfortable supportive shoes, and eat a nutritious meal or snack at least an hour or two before exercise. As a woman enters her second and third trimester, she gains weight. Consequently, her balance may change while ambulating and moving from various positions. Therefore, she must be careful when utilizing and getting on and off of machines and up from the floor. After pregnancy, the woman can begin low-intensity exercises approximately 2 weeks after a vaginal birth and approximately 4 weeks after a cesarean birth. Pregnant women are more prone to iron deficiency anemia because the iron must adapt to the increased blood volume which occurs due to the pregnancy as well as the addition of the fetus's blood volume. Therefore, pregnant women need iron, B12, and folate supplementation in their regular diet. In addition, we must make sure that the pregnant woman must avoid dehydration and exercising in the heat. The environment must be comfortable and they need to drink plenty of water during exercise. If the athlete has any signs or symptoms of dizziness, fatigue, uterine cramping, vaginal bleeding, or dyspnea during exercise, we need to make sure we stop the exercise immediately. We need to have the athlete cool down briefly to restore cardiovascular and respiratory function to normal values, and then have them sit down and hydrate. If uterine cramping and vaginal bleeding still occur, we need to refer the athlete to their physician immediately or call 911.